All right. Good morning, everyone. My name is Nancy Quiroz, and I am the nurse educator for St. Peter's University Hospital. Today, I will be giving a presentation on COVID, flu, RSV, what to know and what to do. And as I tell everyone, prevention is key, right? So you don't know what you don't know, and I'm here to kind of give you a small tidbit of information. And of course, afterwards, if anyone has any questions at the end of this presentation, you will have my information where you could reach me via phone or email, and I will be glad to assist you. All right, what to know? So, right now, during this winter season, we are expected to have what is being considered the trifecta. That would be COVID, flu, and RSV. They are three different viruses, and it is a possibility to have all three at the same time, which is why this is very important information for you to have, especially if you are a person who is considered high risk with a compromised immune system. It's very important for me to give you this information, okay? So, respiratory viruses such as COVID 19, RSV, which is respiratory syncytial virus, and the flu are very common right now in the fall and the winter. They are, like I said, they are different viruses and can happen at different times or at the same time. They typically spread by droplets produced when someone who is sick coughs, sneezes, or talks. And that's why you have seen throughout this pandemic where we request 6 feet of separation, because if someone coughs, those droplets get in the air. And if you're in close proximity, you can inhale them, you can swallow them. And that's how the virus, one of the ways that the virus could spread. You can become sick if you're infected with those droplets, like I said, or mucus enters your eyes, your nose, and your mouth specifically. Okay. The symptoms. So RSV, like I have here in the presentation, you may start coughing, sneezing, having a runny nose, congestion, fever, chills, and a loss of appetite. For RSV, the length of the symptoms can be about 7 to 10 days, and that is normal. Okay, that is normal to last, and not every person's alike. So keep in mind, uh, it may be less for you, but it may be a little longer for others. Now we have COVID-19 and flu. As you can see, COVID 19 and the flu have similar symptoms. They're just a little more than RSV. It'll include shortness of breath. You could have the difficulty breathing, the muscle aches, body aches, headaches, but it'll also include vomiting, nausea, and diarrhea. None of those are pleasant, of course, but please keep in mind the higher risk age groups, children and older adults tend to have these symptoms a little stronger than most. Okay, so those are the age groups that I would definitely pay a little closer attention to. With regards to the flu, the length of the symptoms can be anywhere between 7 and 14 days. For coronavirus or for COVID 19, we have seen that the symptoms can last anywhere from 7 to 25 days. And again, not meant to scare you, but just keep in mind, like I said, everyone's different. Okay, so some symptoms may be less for certain people and longer for others. If you see that it's something that's going into 25 days, of course, monitor your symptoms closely. And of course, at any time, if you feel any concerns, visit your doctor or your local ER. Okay, I always recommend that. And again, these are just recommendations, but whatever you choose to do, please speak to your primary care physicians as they are the ones that know you best. Okay. Prevention is key. Now you can look at these pictures and think it's funny, right? I have a picture of soap, I have a picture of Clorox wipes and hand sanitizer, but you'd be surprised how these are not really used correctly. So prevention, you would think wash your hands. Washing your hands is a big thing. Now I've seen people just gather some soap, lather their hands for a few seconds, wash, and done. That is not enough. You are expected to wash your hands at least 20 seconds with enough friction. The friction is what's going to help break down bacteria. And of course, make sure your soap is an antibacterial soap. But my biggest teaching moment in public that I've done a lot is make sure when you're washing your hands, and I hope everyone can see me because I can't see what you're seeing, is the friction in between your fingers, your hands, the back of your hands, which a lot of people, you just go over 2 seconds. No, you have to have friction in your hands, between your fingers, especially that area between your thumb. Now, it's also very important. I always recommend going up to at least your wrist area, right? Make sure you're doing the same friction. And it's very important because these are the areas that when you place your hands on the table, you always place your wrist there. So you don't want to only wash your hands, you want to make sure you go at least right above your wrist. Now, also, remember those hands that if you don't wash them correctly, they're touching your eyes, your nose, and your mouth. So you want to make sure, obviously, if you have an itchy eye, you're going to you want to scratch your eyes or your nose. So make sure your hands are washed before you do that. Now, with kids, one of the biggest lessons that I've learned throughout this pandemic and having spoken to several colleagues is we think the masks are funny, right? Kids never keep their mask on, but that's what preventing them from putting their hands in their mouth and their nose and their eyes and spreading the virus that way. So also another thing, teach your kids how to wash their hands, make it a fun activity at home, and I promise you they will learn because everything starts at home, right? Especially at a young age. After 21 days, it becomes a habit, it becomes second nature. Clean your surfaces frequently. This is where I have the Clorox wipes. These Clorox wipes are approved to kill off the COVID-19 virus. If you look behind the bottle, it may list the viruses that it will clean. You could also look it up on the website. There is you could check on Clorox specifically if you'd like, and it will show you with pictures which products they have that are effective against viruses. Okay, so I thought I'd bring that out to your attention. But also, these Clorox wipes will help keep when you're home. Remember all the items and the areas you touch. For example, your remote control, your cell phone, your keys, your doorknobs, areas that I'm sure everyone cleans and you tend to forget about it. It's normal. How many times are you touching your remote, right? So make sure you wipe down your remote at least once or twice a week. Um, Ladies and gentlemen, your handbags, your work bags, the bottom, the surfaces, we put our bags everywhere and we tend to forget. Also, if people are sneezing in the nearby area, make sure that you clean your bags. Your keys, you're touching them every day, right? You're touching your car, make sure that you're wiping down your keys. And of course, I always do. I'm always extra. I carry a Lysol bottle in my car and I'll tend to spray my car, especially if I go to the car wash or see the mechanic. That's just something extra that I do. You don't have to do it, but this is just an example of how to keep how to use your wipes and how to keep your home clean. Also, something that works: open the windows in your home, let your house or your apartment air out. It does help. You don't have to leave them open all day, but even if you step out and maybe 30 minutes just to air out your house and get some fresh air, that does help as well. Now, with coughing and sneezing, um, please try to keep in mind if you're out in public, a lot of the times you're going to cough into your hands. This is where I have the hand sanitizer and it comes in. Also, when you sneeze, teach your children sneeze into your arms, right? If you have long sleeve shirts, sneeze into your elbow area, right? That helps out a lot. In your shirts, you can sneeze into your shirt if you don't have a napkin or a tissue handy. It sounds silly, right? Because sometimes we sneeze and it's usually followed by something if you're out and it's really cold, right? But you rather have it on you or in your shirt than project it onto someone. And I know it sounds silly, right? But you just never know, especially now the cold weather's coming. Everybody has a runny nose. You just want to make sure you're safe and we're keeping each other safe. And the biggest thing, stay home if you're feeling sick. Keep your children home if you're able to when they're feeling sick. You send them to school, they're just going to come right back home. And I know it's hard, especially right now. Times are difficult, right? But the biggest takeaway from this is if you're sick, you're going to get your coworkers sick, and it's just the monopoly because you never know what's going to happen, right? So we want to protect each other. We want to help each other, our friends, families, and coworkers. Just please stay home if you're sick and keep your children home as well. Avoid close contact with sick people, which just comes in hand with staying at home if you're sick, right? Simply because you just never know. That one person that you might not have any symptoms, what we call asymptomatic, may be that one person that's carrying around the flu, or maybe carrying RSV, or maybe carrying COVID. Um, However, I apologize. Let me backtrack. If they have the flu, they'll probably feel symptoms, right? But with COVID, we have seen during this pandemic that they can be asymptomatic. They may not feel any symptoms and be walking around positive. So please keep that in mind. Okay. You just never know. It's not meant for you to walk around being paranoid, but you're very well going to the supermarket, you're doing your laundry. You still have to live a life and go out, but just be safe. Okay. And again, this is a continuation of prevention, wearing a mask. Keep one handy. It's just in your best interest to just keep one handy. I know I still see it now. We walk into a supermarket or a shopping center, someone sneezes and everyone gets alarmed, gets scared, like, oh my gosh, what are they sneezing? What do they have? Are they sick? You can't help it. After 2, 3 years of going through this, it's going to happen. If you want, especially if you're still going to your doctor's offices, because now we've always had telehealth accessible, right? But if you're like me, that I prefer to go visit my doctor in person, just carry a mask. Do yourself that favor, and you probably feel better about it. Again, the hand washing, we went over that. It's very important, but also vaccines. And please take that with a grain of salt. You do your research. These are just suggestions made. Again, not forcing anyone to get vaccinated. This is just simply information that I'm giving out to you that I've gotten from the CDC and New Jersey Department of Health. Again, simply recommendations. You do what works best for you and your family, okay? Prevent the spread of flu. I'm visual, right? So I like to have visual information for everyone, and I think this is very cute for children that to see that they understand. Avoid contact with sick people. If you have flu-like symptoms, stay home until 24 hours after your symptoms disappear. It's really 24 hours. If you're not febrile, if you don't have a fever for 24 hours, that's more of a safer bet. Okay, if you're having a fever, you're actively able to spread the virus. So please keep that in mind. Disinfect your surfaces, wash your hands often with soap and water. And just like if you were to get any simple cut, soap and water is enough. Okay. But also keep in mind if you do feel like you're very sick and you want to see your doctor, you could give them a call. If you're having chest pain or shortness of breath, and while you're sick, then please visit your local ER. Okay, I'm not trying to imply that you shouldn't see your doctor or you shouldn't go to your nearest ER. If you feel like it's to that point where you're very sick, because you can have complications from a flu, from COVID, and from RSV, please keep that in mind. Use your judgment. Obviously, if these methods are not enough and you do not feel better while you're at home, visit your primary care physician or your local ER. Okay. Avoid touching your nose, your eyes, your mouth while you're sick, because that's how we could spread the germs faster. Instead, cover your mouth, your nose, with tissue when you cough or sneeze. And you see the same. My presentation sounds like I'm very repetitive, and it's on purpose. I am doing that on purpose because these three viruses are very similar. They have similar ways of uh, infecting the public. So I want to make sure that it is that I'm making a point to you, right? Just got to take care of yourself and keep these in mind. I figure if you hear it 3 times, it'll stick. Now, prevent the spread of RSV. Again, same coughing or sneezing, you'll get it through droplets from a cough or a sneeze in your eyes, nose, or mouth. If you have direct contact with the virus, let's say if you want to hug the person or you kiss the person, or if your significant other is sick, you will get sick as well. If you touch a surface that that person has touched while they're sick with RSV, you may very well end up with RSV. Preventing the spread. There's a lot more information than what I'm giving you. Again, remember the CDC website has the information as well as the New Jersey Department of Health. But if you also Google RSV, you'll go specifically to the RSV website where there's information, additional information. There is an RSV vaccine, and we'll cover that shortly. In order to prevent the spread of these viruses, for example, I have here preventing the spread of COVID 19. You could stay up to date if you'd like. As of September 11th, a new vaccine came out for Moderna, Pfizer, and Novavax. Local pharmacies do have the vaccine available. And again, just recommendations. Please do not be upset. You could do your research and do what's best for you and your family. But pharmacies such as CVS and Walgreens have the vaccine available. You can also go to vaccines.gov, enter your zip code, and find the nearest pharmacy to your zip code that may have the vaccines available. Following recommendations for what to do if you have been exposed, staying home when you have suspected or confirmed COVID 19. It is still very active. You could look up if you'd like to know how you're doing in your county. The CDC has that information as well as the New Jersey Department of Health. Avoid contact with those that are sick or that are suspected with COVID 19. The point of the vaccines is not, the vaccines will not prevent you from getting COVID 19 or RSV or the flu. It will lessen the symptoms if you should get it. Okay. So that's also something that I'd like to um, clarify for everyone. I know that's one of the biggest misnomers with people keep asking me, oh, but I just got vaccinated. I still got it. Yes, and you can still get these viruses even with the vaccine. Okay, the vaccine is just to help lessen the severity of the symptoms. Okay. And again, I just went over the COVID-19 vaccines. Vaccines can be free if you qualify through the Bridge Access Program for adults. There is also a 317 program for uninsured adults, and Vaccines for Children program for those that qualify. St. Peter's offers these programs at the Family Health Center located at 123 Howe Lane. You can schedule an appointment with a provider, become a patient at our location, and we can further guide you there as well, okay? RSV vaccines. The CDC recommends that you use one of the two tools to protect your baby from getting very sick from RSV. So, children, there are vaccines for kids. An RSV vaccine can be given during pregnancy, and an RSV immunization given to infants and older babies is available. Most infants will not need both. Okay, so that you would need to speak to your doctor. RSV vaccines are available for pregnant people, and it is available between 32 and 36 weeks during September through January in most of the United States. Okay, some areas where the RSV season is slightly different, you can have adjustments to the months when the RSV vaccine is recommended. Okay, the vaccines will provide protection against severe illness in the recipient's baby for up to 6 months after birth, which again, you can speak to your medical provider about that and see what works best for you. But I'm here to provide you with this information. Prior to this educational session, I was not aware of a lot of this information. So I just felt that it would be best for me to also educate you on this information, especially for anyone consider getting pregnant, to keep in mind what vaccines you can or cannot get. So with RSV, now there is a new vaccine for adults. Adults 60 and over can get the RSV vaccine. Um, Always recommend you speak to your provider first. I believe this vaccine came out earlier in the year. I want to say in May. And there is over a 90 percentile of efficacy rate. And you can look into the CDC website for further information on that. Okay. Babies, they receive antibodies from RSV. Antibodies are given to the baby. Is it for everyone in the group? Well, all infants entering or born during RSV season can get it. Small groups, oh, sorry about that. Small groups of older babies can get it for a second season, as well as babies. The RSV vaccine can be given during pregnancy. And again, it can be given during 32 to 36 weeks of pregnancy during September through January. Influenza vaccines. There's different influenza vaccines that are approved for the age groups. People as young as 6 months old and older can receive the flu vaccine, and there are two vaccines approved for ages 65 and older. One is just a little bit of a higher concentration than the other. Flu shots are also recommended for pregnant people and people with certain chronic health conditions. Again, that will be something you can discuss with your medical health provider, okay? There is a nasal spray flu vaccine approved for people 2 years to 49 years of age, and people who are pregnant and people with certain medical conditions should not receive the nasal spray flu vaccine. Again, providing you with this information, please speak to your primary care to see which works best for you. Where to find COVID-19 vaccines? You could speak to your healthcare provider to see if they have it at their location. You could check your local healthcare centers. And like I said, vaccine.gov is a great resource for you. It will give you the opportunity to enter your zip code and let you know what pharmacies nearest to you participate with the Bridge Access Program, which pharmacy may have vaccine specific locations, such as pharmacies that have Moderna, pharmacies that have Pfizer, and it also breaks it down by age group. There's retail pharmacies like such as CVS and Walgreens that may have these vaccines available for you. I use those because those are the ones that are most familiar with my patients. But please, if you have local mom and pop shop pharmacies, please give them a call and they'll let you know if they have it available. My references for today, these are the references used, but mostly I do my best to get my information directly from the source, the CDC, the New Jersey Department of Health, as we typically get all our information from them to provide to the public. One thing that I did forget to mention, the COVID-19 vaccine. All these vaccines are available, of course, at your local pharmacies as well. And you could speak to your primary care physicians. The COVID-19 vaccine can be given during pregnancy, and it can be given at any stage during your pregnancy. And again, if you have any further questions, speak to your provider, but I am also available here to answer any of your questions. I know it seemed like I just threw a lot of information at you because the signs and symptoms, although very similar, not every person will have them at the same time. But you can get flu, COVID, and RSV at the same time. So keep that in mind. Um, in summary, it is always recommended you get the vaccine. Uh, Please wear a mask if you're out in public and you don't feel well. Stay home if you're sick. Wash your hands often with soap and water, remembering for 20 seconds, keeping that friction going. Use hand sanitizer or carry a small bottle if you're out in public or you're on vacation. It should contain at least 60% of alcohol or 70%. If just in case if hand washing isn't available, please do not apply straight alcohol on your hands, that can damage your skin. And of course, stay 6 feet apart if possible from the next person, especially if you're not feeling well or they're not feeling well. You know, it's been a troubling and very exhausting past couple of years with COVID, but I'm here to help educate. I'm here to give you as much information as I can. And I hope this is a quick educational session, right? But if you have any questions or concerns, my information is on your screen. We do appreciate your time. Please reach out. Again, reach out with any questions or concerns. I hope this was enough for you to share, enough for you to learn and share with your family members. If you have any other suggestions of presentations that you might like myself or someone from St. Peter's to bring out into the community, please let us know. I'm always open. I'm open to suggestions, and I hope that I did you some service today. Thank you so much for your time. Be well, stay safe, and stay warm out there. Absolutely. If you have any questions or concerns, please, if anyone has questions here, because we do have some people in person, of course. I have my family members at home watching. So of course, if you also have any questions, please let me know. Send them to me, and I'll make sure that I'll answer them while I'm here. Sure, sure. So let me. Yes, I saw you had a question. Do you have a question? So that's always a very interesting question. I get this question a lot. So, per the CD says you can receive multiple vaccines simultaneously. It should not be an issue. Now, they do recommend get one vaccine in one arm, the other vaccine on the other arm. But if you're someone um, that you have experienced allergic reactions before, because there are some people that are very sensitive and they tend to get allergic reactions from vaccines, or just feel very sick after the vaccine, then I would say wait at least 2 weeks between vaccines. It does take at least 2 weeks to receive full immunity from the vaccine, but per the CDC recommendations, there is no issue if you were to receive the COVID and the flu vaccine together. We've done it at several of our clinics, and so far, so good. We haven't had any issues that I'm aware of. Yes. Okay. So the question was, if you've received the pneumonia vaccine, do you need the RSV vaccine? And my answer to that would be yes, because they're two different medical conditions, so they will be treated differently. And the RSV vaccine, again, RSV is seasonal. You can get pneumonia at any time, right? So, but the RSV vaccine, it is recommended to get that. And again, it's new. It just came out this year, so keep that in mind. But yes, it is recommended you get both. And the pneumonia vaccine is not a yearly vaccine, so you should be fine. Okay. Now, there was also another question that I've received before. If you're feeling sick, do not get vaccinated. There's always someone there to greet you, speak with you when the nurses that are vaccinating you. You'll notice they will ask you, "Have you been feeling sick? How are you feeling today?" We will not vaccinate you if you feel sick. If you have a cold, any cough or runny nose, we will not do that. Okay, so it is recommended you wait until you feel 100% better before you get any vaccines. Yes.
I haven't kept up on it, but
So Novavax is just a different type of Novavax is a different type of COVID-19 vaccine. That's all it is. It's a different component. Um, I'd like to tell you that I brought it with me. I don't have it with me. Can they see my screen here? Okay. So
is that produced by a different?
it's produced by a different company. Yes. So we have Moderna and Pfizer, and they are both similar. They're mRNA vaccines, and I'll explain that to you as well. And I have a flyer for that.
You want me to stop sharing the screen?
Sure. You tell me, and
Yeah, let's see.
oh, I hear stop sharing.
Okay. And
Yeah, I'll provide you with that information. So I'll show you that now. Okay, no problem. Are we still recording for them?
yes.
Okay. And these are always good questions. I just like to have the information in front of me so that way um, I give them the accurate information, right? Because again, I get all my information directly from the CDC website, uh, and I make sure that I have the correct information with me. So we have here the Novavax is a protein subunit COVID-19 vaccine. What that means is that the protein vaccine contains pieces of proteins of the virus that cause COVID-19, and they're called the spike protein, where you have mRNA vaccines that are both Pfizer and Moderna. Um, it says it has a piece of the protein that triggers an immune response inside and outside your body. So it's a little different, but again, I personally have not met anyone that's had the Novavax vaccine. Not to say that they're not using it. I have only been familiar with Moderna and Pfizer, but I do have a flyer. I do have a flyer on both. And unfortunately, I can't show it to my Zoom audience, but I do have a flyer where it breaks down the information a little better right here. So the mRNA, which would be Pfizer and Moderna, it provides the body instructions. It provides instructions to the body to build harmless pieces of a protein from the virus that causes COVID-19. It causes an immune response that helps protect the body from getting sick with COVID-19 in the future. So the mRNA is going to teach your body that immune response, and it'll kick in to protect you from the virus itself. And this is, let's go back to the Novavax. It's a good question. I haven't had to explain it to anyone yet, so I apologize if I sound a little tongue twisted. It's usually I get the questions about Moderna and Pfizer, so I'm very happy someone asked that for me today. So right here with the Novavax, the protein causes an immune response to help the body. It has these are part of the ingredients. So I'm not going to go over each ingredient because it's a lot of information, but it basically works to keep the vaccine molecule stable and also trigger that immune response in your body. So they do sound similar. Their ingredients are different, as you could see here, but the sole purpose of both vaccines is to work in a similar manner to help your body create and build that immune response. So if your body gets attacked by the virus, your body's going to know how to react to it and how to take care of it. Now, this is why we tell and we recommend booster shots. But this new vaccine that came out is not a booster, it is an entirely different vaccine. Okay, so that's why you're not really hearing the word booster thrown out this time around. It's an entirely different vaccine because there is a new variant that is out this season. Okay, so this new vaccine will treat the new variant that is out. So I always have to remember how I say that. Okay. So with the Novavax, once the virus it has a spike protein. That protein will learn how to respond, and your immune system will be able to quickly respond to the actual virus in your system, if that makes it better. I'm trying to say it as easily as possible and in simple terms that you can understand. And if you need more information, I absolutely have that with me. I brought it in a separate binder. So, like, I have a patient fact sheet that we can give you. This is what we give to patients when they are vaccinated. So, remember, if you ever get vaccinated, we do have an informational fact sheet for you to use that explains and breaks down the vaccine. That way, you have that on your file, you have that paperwork with you. And if anyone that's watching the Zoom video, if you need that, if you'd like that information, I can provide that for you as well. Okay. Let's see.
Everyone who registered online, we can share their handouts, like, we can send it to me on
I'll send, okay, perfect. I could send that to you. And this is all information that's readily available for the public. I'm not creating anything. I don't do that. I simply get my information directly from the CDC website. Also, the FDA is another good source. The FDA provides us with information as well. So please know that any of the information that I have today, it comes straight from these um, reputable sites. Okay, and I'm not making anything up, and I don't create any of this information. The only thing I do is present the educational material that I compile information directly from the FDA, the CDC, and the New Jersey Department of Health. And they do tell you, they give you recommendations of who should not get these particular vaccines. So if you're someone that has had severe reactions to it before, your primary care will speak to you directly and will probably give you the recommendation to hold off on the vaccines. But again, it's a personal choice. I'm just here to guide you with it, with the information.
3 questions.
Sure.
So we have, are free COVID tests still available by mail?
So yes, if you go, yes, they are. Again, I don't know if you've already received them after September 11th. They are giving out an additional, I think, four. I just received some in the mail, and yes, you could Google that free COVID vaccines, COVID kits. I believe you should get four. I think it's 4 or 8 per household, but yes, you can. Check your, let me see if I could pull up that website and I'll give it to you. But the answer to that question is yes, because I actually did just get some free COVID kits. But if you come to any of, I will be leaving some kits here at the library. If you happen to have a chance, I will leave some here today. But I will also get you that link, and I will provide that for you shortly. Free COVID vaccine. It should be covid.gov, yes. But you could also check USPS.com, because I believe that's where you could order some. Also, if you happen to be someone that uses Express Scripts, I know Express Scripts have they were giving free COVID kits. I use Express Scripts, but I'm also on the Postal Service website, USPS.com. They said order free at home COVID-19 test. It says here you could get 4 rapid antigen COVID-19 tests. Now, again, I believe it's per household. So if you've ordered it before, just make sure to see if you qualify for another 4. Okay.
Is there a test for RSV and flu?
So yes, if you were to go to your, let's see, I'm trying to think, like your minute clinics, right? Like CVS has minute clinics or primary care. They're usually nasal swabs. They're swabs. So you could get your flu. You could get tested by flu for flu and RSV either at your local minute clinics or your primary care's office. But yes, they're usually swabs. Now, I don't know if you're a family member when in the hospital, and I say this just for common knowledge, they will do what's called a respiratory panel. So patients, if they're getting admitted into the hospital, they can request that, but a lot of the times they do it automatically, just given the season that we're in. It's called the respiratory panel, and they can also do that for you as well. But for someone that has that, like a minor cold or flu-like symptoms, if you go to the minute clinics or urgent cares, they are able to test you for that, for flu and RSV as a swab. It should make maybe like 15, 20 minutes and you'll have a result.
Next question on the chat was, how safe is RSV? Is the RSV vaccine?
So thank you for that. It's a good question. And I do remember having to answer this recently for someone. So the RSV vaccine, let's see, I will tell you right now, the vaccine itself, if I'm not mistaken, it's created through Pfizer. So if you really wanted to look up vaccine information, you can visit their website. Last I checked, it was I believe, in the high 90s percentile efficacy rate. And I'm looking at it now, so I can give you an exact number. But it is RSV can be serious if you're 60 and older, especially if you have asthma, diabetes, COPD, or heart disease. That puts you in a higher risk because RSV tends to give you some respiratory issues. And like I said, the vaccine is available, and there is a 90. I want to say, I think it said 94% efficacy rate. Okay, but again, this is something, I give you the information, and it is available online for you to check. And please speak with your primary care provider to see what works best for you. I know it's fairly new, it came out this year. So I've encountered the public to be a little bit hesitant about receiving this vaccine. As of now, um, what I could tell you, I'm looking, trying to find some of the CDC recommendations for you. It says right here, let me see, adults may receive a single dose of the vaccine, of course, based on the discussions with your healthcare provider. And for this season, it is offered for anyone, patients age 60 and older. Per the CDC, you can administer, you can have co-administration with other adult vaccines during the same visit. It is acceptable, but that's also a personal choice. Okay. And we're doing here, learn about the RSV vaccine. Yes, like I said, like about 94% efficacy rate, which I think is pretty good. And that's almost as in the same suggestion here. Let's see. Information wise, I'm trying to get you statistics. Okay. It says 18% of people being that end up with RSV, and a lot of the times it's in the older population. 18% end up in the ICU, 31% receiving home healthcare services at discharge. These are typically consequences of RSV hospitalizations, of course, and 26% usually die within 1 year after admission from RSV. So, numbers to keep in mind, because RSV remains undertested, underdiagnosed, and a lot of the times misdiagnosed because, if you already have a breathing issue, it may go undetected. But now they're starting to pay a little more attention, and you can go to There's an RSV website. You could look through it directly through the Pfizer website as well and get information on the vaccine, and they'll have statistics for you there as well as on the CDC website. So I hope I was able to answer your question and give you additional information as well.
And is the RSV live vaccine? That's another, if that's.
Let's see. Let me take a quick look at that because I'll be honest with you. I have not. You know what? No one asked me that question before. So bear with me one moment. I'm going to look at my healthcare provider website so I could tell you. I want to say no, but let me see. I want to give you the correct information. View clinical data here. Let's see. Also, right here, 96.6% of an efficacy rate, okay, when they first started this study. So it is working. Let me see about if it's a live vaccine. That is a good question. Contagious. And I apologize because I should have known that. You know what? And there's no one asked me that, so I didn't even think to write that down. Let me see. Is alive. Let me just get that for you. Learn about it. Let's see. Here we go. Uh, I'm getting it now for you, so I apologize. How many doses? Let me see. And I'm on the CDC website, so I apologize. Live vaccine. It keeps bouncing me back. I'm going to get that information for you. Let's see. I don't really know. It's not telling me. I got to go through Pfizer. Let's see.
Find it now, maybe that should be something I can have.
I know I do have it on a handout with me. For some reason, I just don't remember right now off the top of my head, but I will have it. Let's see, because it just keeps giving me the age recommendation. So I will get that information for you, and as soon as we're done, I'll get that for you because I have it in my paperwork.
And another question, someone said that they took a COVID booster in August. Should they get the new COVID shot now?
So for the new one, you could wait at least 2 months before 2 months after you, well, also depends, right? So 2 months after you've received your last vaccine, you can get the new COVID vaccine. And before we were telling everyone at least 4 months per the CDC recommendations, right? But now you can get that between within 2 months of your last one, and you can't wait. You're still protected with the current vaccine that you've received. You are okay. Um, so I wouldn't worry too much. But because the new one covers the new variant, that's where I would say it is important for you to receive the new vaccine. And if you need that information, again, it is on the CDC website. You could look at the interim considerations, that's what they're called, and it'll let you know. It has as a visual form. It has, if you're a visual learner like I am, and it also has in written form. The information is there in case you have any doubts. It will give you the correct dosing schedule for yourself, for your family members. Okay, so just so that you know, it'll be on the cdc.gov vaccines website, and you could type in COVID-19 interim considerations, and it will let you know. That was for COVID, yes, yes. I just always like to tell them where to look in case they want to find.
I'm gonna put it in the chat.
Okay.
The last question in the chat is Paxlovid recommended for RSV?
Paxlovid is for COVID. And you're saying what? I'm sorry?
They're asking, is Paxlovid recommended for RSV?
So that question right there would actually be more of a question for your medical provider. As far as I know, Paxlovid is for COVID-19, and they usually have a certain criteria. Your primary care provider would be the best person to ask that question to. I am not aware of Paxlovid being given to RSV patients. My experience has only been to kind of write out the symptoms, but again, I'm not a doctor. So, and there are certain criteria that you would have to meet in order to use the um, Paxlovid medication. From experience, I've seen patients use that during COVID. So I've seen them receive that medication while they've been a high risk patient, or they've been in the hospital with COVID-19. I am not aware of them using that for RSV. So, yes, that unfortunately would have to be a question for your primary care provider, simply because I'm not aware of that. Um,
And I'm gonna put that link for the COVID-19.
yes, yes, yes.
Chat. And that's it. Those are the only questions that we got.
I really do appreciate all these questions. Thank you so much. Simply because now I know I'll come up. I'll have more answers, more questions and answers ready for the public for the next time. You asked me a lot of questions, and I do appreciate it. It's very good to have. Challenge me, please. I love that. But again, I wish I knew. And I'm sure I could get you that information. If there is a specific medication for RSV. It is a virus, and a lot of the times viruses, um, unless there's a certain level of the your medical condition, or if there's a reason to, the primary care will give you medications. It's just unfortunately I'm not well versed, and also I'm not a doctor to give you medical information online. I just provide you what I have here, and what I use from the CDC. So I do apologize for that, but of course we can get as much information for you as possible, and I could give it here to the librarian and to the staff to hand out to you. But always, first and foremost, I will always say, any questions or concerns, ask your primary care provider. Okay.
And someone says, thank you very much for your presentation for the library as well.
I appreciate that. Thank you.
And,
Absolutely.
um, if you take a COVID test,
Mhm.
kit, and it's negative, does that only mean if you don't have COVID, but you could still have RSV?
Correct. So this particular kit, like I brought a kit, I'll show you. Like I brought these in today for the library. So if you're able, I will leave some behind. So if you're able to come to the library, it's one kit per box. So these kits will only test you for COVID. These will not test you for the flu. These will not test you for the RSV. So you would need to visit your local clinic or your doctor's office to get a specific test done for flu and for RSV. So another tidbit of information, depending on the time of exposure, if you test too soon, yes, it will test negative. So a lot of the times you will probably experience symptoms, I would say, between 2 to 4 days after exposure. Some people have it immediately the next day. And again, that could also be your immune system because depending on your immunity depends on how fast you get sick. So something to keep in mind, if you're exposed today, don't test yourself today, don't test yourself tomorrow, but give yourself at least 2 days because you still may not test positive. So I don't, you probably wouldn't want to waste your test.
Your pages, stage update, is that the same?
The contagious stage, honestly, it would it would really remain the same. What I use, we look at the fever, or at least what I've always been taught would be if you have a fever, that's like your most contagious period. The first 5 to 7 days would be your most contagious, but you once you have a 24-hour window with no fever, that's your best bet to use as a guidance. Okay. And I brought in these sheets that I'm also leaving behind. I know you probably can't see it, but I'm going to leave this informational sheet behind. This information, it does give symptoms for asthma, seasonal allergies, cold, COVID, flu, and RSV. It gives you the length of the symptoms and it tells you the symptoms and how often you get it. I found this to be very informational, something for you to look at and kind of use as a guidance. Again, this is just a guide. This comes from the Asthma and Allergy Foundation of America. So it is a legit website, aafa.org. So in case you want a copy for yourself, I will leave some behind here for you. I do have information on the new COVID variant as well. If you're interested, these flyers I will be leaving behind at the library. Um, and I know everyone's probably tired of hearing about COVID, but it's just very important for this season simply because of the expected um, influx of COVID, flu, and RSV, and the possibility of having all three viruses at the same time. So I wanted to at least try to educate you as much as I can on what to look out for and what to do should you feel very sick. And of course, if it's something you feel you can't manage at home, visit your medical provider. But most importantly, anything that causes you shortness of breath, chest pain, if you notice that someone like I say, an older adult or a young child, if they start getting confused and or acting out of their normal behavior, then that would also I would also recommend visiting your local ER. Um, sometimes we tend to ignore that, but confusion and lethargy, loss of appetite, or if you look at their mouth and their gums, if they're dry, that's a sign of dehydration. For babies, if they're not wetting diaper, also a sign of dehydration. So those are also things to consider, but not the only ones. Those are some. So definitely just trying to have a teachable moment. But please ask me any questions that you have. You could feel free to email me and the information provided. I am here to help you. And I hope to continue to come back here and be able to have further presentations with you. I really do enjoy doing this. And thank you so much for your time. And thank you for everything, for your questions.